Talk a little bit about the difference between non-stuttering like disfluencies and mazes.
So there's a lot of overlap between those two. And so something that I talk about a lot is, do they really have to be defined that differently? So when we talk about a non-stuttering like disfluency versus a stuttering like disfluency, we're focused in on a certain population where we're trying to make a differential diagnosis of, does this person stutter, does this person not stutter? When we're thinking about mazes, we tend to not have that counterpart, right? We tend to not have the counterpart of something, for example, like a stuttering like disfluency. The mazes are appearing and tend to signal like a red flag for potentially a communication or linguistic breakdown, language impairment. So when we're thinking about mazes, I'm really thinking about a real-time revision of what someone is saying that is not indicative that they necessarily have a communication impairment. It's more indicative that they may have caught themselves making an error or caught the wrong word, for example, and they are changing what they want to say mid-sentence. And so we see this a lot with dual language learners who are code mixing, you could say, going from one language to the other, kind of to fill the gap in their knowledge and revising what they say, especially as they are learning two languages. Whereas a child who stutters is going to exhibit some different types of disfluencies for some different reasons. And so that's where we can kind of make some of those distinctions between the two.